So welcome, my name's Armel, I'm a therapist, and what I thought I'd do is say hiya from my home office where I work. I do work remotely, but I also work sort of face-to-face in a clinic in the northeast of England. And I'm working with clients now, but it's kind of occurred to me that I'd really like to sort of just put something out there that might be of help to kind of the wider public, really, people who might be going through some tough times at the moment. It's an exercise that is part of EMDR, which is eye movement desensitization reprocessing, which is a way to work with trauma. And for those of you who are in the UK, that's a NICE approved treatment that is available on the NHS. So it's something that we can use actually when we're going through some really difficult times. So it's really useful for counsellors, therapists who might have heard a lot of really difficult material during their sessions with their clients. It's also really helpful to healthcare workers, helpers of all kinds, people who are going through some difficult times at the moment, and anyone at all who might be going through a period of overwhelm, because I know a lot of people are feeling overwhelmed at the moment. And when people are kind of feel the loss of anything, whether that's a person or whether that's a thing like a job or just the sense of sort of day-to-day normality. So what I'm going to do is I'm going to introduce you first of all to the positioning of your hands, and this is called a butterfly hug, as you'll have seen from the title of the video here. And what we do is we cross our arms over our chest and we just grab our shoulders like this. Okay. So then if you have a little look at the kind of what I'm doing is I'm going to just lift my hand, but I'm going to leave the heel of my hand against my shoulder there. So you can do this kind of, with me and just sort of practice. And then what we're going to be doing is we're going to be going right, left, and just flapping our wings from side to side. Okay, so that's essentially what we're going to be doing. All right. So this is a way of looking after ourselves. It's not an alternative to therapy, but actually at the moment, it may be a way of keeping ourselves out of having to go to therapy after this is all over. So I'm hoping that a lot of people are going to be using this. So essentially what I'm recommending is after, a tough day, that you just take a little bit of time, maybe 5-10 minutes, just to kind of review your day. So that might be at the end of a long shift. You might be in the car before you set off. It might be when you get home. It might be at the end of the day. Okay, so you decide when the best time is for you. What we do is we start off by doing something that I call belly breathing. So what we're doing is we're not breathing any more deeply or more shallowly than we would normally, but what we're doing is we're making sure that that breath goes right deep into our belly. So imagine if you had your hands on your belly, and you might want to do this. You put your hands on your belly, you'll be noticing your belly rising and falling with each breath. So rising as we breathe in and falling as we breathe out. So we tend to fill our lungs first, then our belly, and then empty our belly and then our lungs. So just noticing the in-breath and the out-breath, noticing the belly rising and falling, and noticing the coolness of the breath as it enters your body and the warmth of the breath as it exits. And just noticing the life-giving oxygen in that breath as you breathe in. And just imagining the carbon dioxide, any waste products that you're breathing out. Breathing in and breathing out and enjoying that breath, noticing it going right deep into your belly and then out again. And just keeping on doing that. So that's the start of the exercise, the belly breathing. And this exercise is quite easy to remember. It's just in 3 parts, really. Yeah, we're going to start and we're going to end with belly breathing. And you can also use belly breathing without the butterfly hug at any point during your day when you might need to just come back to yourself. Sometimes maybe when we're having a difficult conversation with a colleague, or we just feel that need to ground ourselves, just coming back to our breath, just bringing it back to the belly. And what that does is that actually helps our parasympathetic nervous system just to regulate the sympathetic nervous system and just balance it out. So the next thing we're going to do is we're going to think about, what disturbing things have happened during our day, during our shift. Okay? What we're going to try and do is we're going to try and rate them on a scale of 0 to 10. So maybe 0 is neutral, it's nothing. It's a very, very neutral day. And 10 is the most upsetting, the most distressing a day could be. So maybe just take a moment to either log that in our heads, or sometimes it can be quite useful just to have a pen and paper if we have those around, and just write that down at the start of the exercise. Yes, maybe it's been a tough shift. Or maybe one of our clients has told us some really harrowing things about, things that have happened to them maybe in the past. So we choose what we want to focus on and we write that down. Maybe it's a 7, maybe it's a 3, just depending. And then what we're going to do is we're going to take up our position, our butterfly hug position. I'm just being careful not to jog my cable here. And then what we're doing is we're just flapping our wings and we're running a movie of all those things that we found distressing during our day or during our shift. And we can keep our eyes open or we can close our eyes. If we keep our eyes open, it can be quite useful to maybe just look towards the tip of our nose. So allowing our eyelids just to droop a little, or just focusing on a really boring bit of the room, like the carpet, maybe a corner of the room. And then we're going to start right, left, and we're running the movie and just noticing, not getting stuck on anything, noticing any emotions arising, any sensations in our body that are different from normal. Sometimes people don't kind of think in pictures, they just maybe see colours or they might hear sounds. That everything's fine. Just allowing, just noticing, and just allowing it to pass through as if we're watching a movie on a screen. And what we do is we keep doing that and just noticing. If we get distracted, that's fine. Just coming back to it. Just noticing whatever's happening in our bodies, whatever's happening in our mind. And we can do that for as long as we want, until maybe we notice that things have just settled themselves a little bit. Okay, so maybe a particularly bad shift or a particularly bad session, we might do that for a while. If it's been relatively okay, we might not do it for quite as long. And when we're ready, when that movie's kind of run itself to a close, we might just lower our hands and just go back to our belly breathing. In and out. No deeper or more shallow than normal, but into the belly, out of the belly, just noticing that breath. And about 10 breaths is usually enough to just give our parasympathetic nervous system just that little bit, additional bit of support. And once we've done that, what we might do is we might go back to that idea of how distressing, the idea of our day or that particular session is to us. Again, on a scale of 0 to 10. So where 0 is very neutral, there's no feeling coming up in our bodies, no emotions coming up in our bodies. We can remember what it is. We could name it. We could tell the story of it. But it's not activating as much emotion anymore. It's not distressing us as much. And just write down on a scale of 0 to 10 where we are now. And ideally, we're thinking about a 0 or a 1, but it's okay if it's more than that. Some things may take a while to clear. And if you want to, if it's more than a 0 or a 1, what you might do is you might go back to your butterfly hug. You might just kind of notice, where that 3, maybe that 4 is coming from. And then just start tapping again. Right, left, right, left. Okay, and then what we do is we'd go back to our breathing. Then we just reflect on what that scale might be again on a 0 to 10, where 0 is neutral and 10 is the most distressed we might be. So that's the butterfly hug, and I'm really hoping that, at this time in particular, this is going to be helpful to people. So I'm going to be sending this out to people I know. Feel free to send it to people anyone, you might think it might be useful for. You can use it for children. You might not be kind of being quite as in depth here. You might not be bothering to ask them to sort of scale their distress on a 0 to 10, but we can tell how distressed a child is, can't we? And actually we can teach our children to do the butterfly hug as a way to soothe themselves. And we can also teach them the belly breath as a way to soothe themselves as well. And a lovely game for children is to maybe get them to lie down, pop a little toy on their tummy, and get them to see if they can make the toy move. So I really hope that this has been helpful, and it'd be lovely to get some comments if you'd like to. Yeah, just let me know how you find that, if you want me to do any more videos, anything like that. All right. Take care, guys. Stay well.